Coming in, Kirsty, does everything look a-okay on the?
Everything looks great.
Hi, everyone. Thanks for joining us a bit early. We will give it a few more minutes to allow others to join us, but welcome. I hope you all are enjoying this beautiful weather, and maybe you're even taking this orientation on a walk. I hope so too. You can listen to us as well. So it's a beautiful day out. So we'll give it a few more minutes while I get situated and organized here. I'll put myself on mute, but feel free to chime in with any questions in the chat while we get started. All right, I think we're going to get started. It's 2:01. I appreciate all of you for being here. Welcome to our 2023 Metro Denver Partnership for Health orientation and welcome. All are invited. We are recording this webinar, so we're able to put it online later for those who weren't able to join us today. So welcome. We are very excited to talk about MDPH and the collaborative. And I know many of you here have worked with MDPH at differing capacities and capabilities. So we're going to start with a baseline and get everyone on the same page today. After this webinar and orientation, everything will be uploaded to the Metro Denver Partnership for Health website, including an updated 2-pager that you can use with your communities and with your teams. So once all of this is uploaded and online, we'll make sure that you all have a link to that and can reference any of these materials later, as well as any materials that we're going to show you today. They'll all be on Colorado Health Institute's website, which is where MDPH is hosted. So welcome. I am really grateful that you all are here today. My name is Nicole Weber. I'm a senior program manager at Colorado Health Institute. I have been helping lead the Metro Denver Partnership for Health over the past 3 years or so. I can't believe 3 years have gone by. And so I'm excited to talk to you today about the history and the structure and actually hear from others who help leading MDPH, who help facilitate MDPH as well. They'll be able to chime in, and then we'll allow time for questions and answers. So here's our roadmap for today. We are going to do a quick welcome from some of our chairs under MDPH, so you get to see some faces and know who's who. Then we're going to go through the history and the structure and the goals of our collaborative, what we aim to achieve. And then we're going to talk about how we achieve those goals through our priority areas and our work groups. We'll also talk about specifically workgroup expectations and expectations you can have of MDPH leadership and of CHI. And then, as I mentioned, we're going to have a question and answer session at the end. This is why this is on a Zoom format rather than a webinar format, a meeting format. So you're able to kind of pop in and ask questions then. Please hold your questions into then if possible, because we have a lot of different moving parts here. You are welcome to put them in the chat and we'll monitor that and can answer questions in the meantime. And so we know what to answer when the question and answer session comes, but just feel free to hold off if you're going to chime in verbally. All right, well, we're going to get started and we're going to have a quick welcome and hello from our chairs. Here is our 5 chairs under the Metro Denver Partnership for Health. We're going to go through this structure in a little bit so you understand what we mean by the Regional Collaborative Committee and what we mean by the Local Public Health Agency Steering Committee. We have Monica Bulig here on the line, Kelly Shanahan, Dr. Judy Schley. I see the 3 of them front center. And we also have Bob McDonald, I see he has joined as well, and Michael Hill from Douglas County. I'm here to say hello, but I'm going to go in order a little bit for everyone to say a little bit welcome. So Monica, do you want to chime in and give everyone a little hello?
Yes, hi, thanks for joining. I have a history with MDPH that has spanned several different organizations. And so it's including healthcare and local public health. And I can say, I'm thrilled to see all of you here. I have experienced on both sides that we are stronger together and able to leverage strengths, various strengths, and reach more people consistently and meaningfully through this work. It's exciting to have everyone here, and everyone here, as you participate, know that this is a true collaborative process, such that we are only as strong as we contribute, and grateful to have the Colorado Health Institute as the anchor for this work. So thank you.
Thanks, Monica. Kelly.
Hi, everyone. Good afternoon. My name is Kelly Shanahan. I'm the Director of Member Experience at Colorado Access. We're one of the 2 regional accountable entities in the metro area, which is that we work with Health First Colorado, the Medicaid program. Welcome. Really glad to have you here today. This is the Metro Denver Partnership for Health is a really high value collaboration, as Monica just said. And because of the membership organizations at the table, there is so much work that we can do together and so much potential. And it also means that we can't have it on just one person per organization to sort of be the subject matter expert on all the different things that we're working on. So by its very nature, we're tapping on the shoulders of multiple folks within our organizations for various work groups and conversations, so that we're bringing that expertise to the table and having the right conversations at the right levels. And it also adds some complexity to sort of keeping everyone on the same page and when staff changes roles. So these orientations, I think, are really important. I know that there's some Colorado Access folks here. I think I saw Taman and Nancy, and there may be others. Really glad you're here. This has been a real pleasure to be involved in MDPH, and I look forward to continuing to do so. Thank you.
Thank you, Kelly. Judy, is there anything you might want to add? I see you off.
I can just say hello to everybody. I see a lot of friends, colleagues that I've known for many years. I've been a part of the Metro Denver Partnership for Health for many years now, and feel a tremendous engagement with this group. I really like the Regional Collaborative Committee because it's pulling together the RAIs, the health system, public health, human services to collectively improve health in the community. And then I've been a part of the local public health agency steering committee, where we've done some really good work to sort of uplift the metro area for public health. I work at the Public Health Institute at Denver Health. I have been in public health for 35 years, and so feel really good about that, plus being a family doc, so I can understand all those avenues of being a primary care provider, plus being public health focused. So welcome all.
Thank you, Dr. Slay. And Bob.
Yeah, hey, good afternoon, everybody. Glad that you were able to join. I see a lot of DDPHE staff on here. So again, thank you to you for taking time out of your day. I have not been in public health for as long as Dr. Schley, but for a long enough time to appreciate the value of partnerships. And I have to tell you that even after a couple of decades in public health, I don't think I recognize that value as much as I did in the last few years going through the pandemic. We were with our partners at CHI just meeting many times throughout every week, meeting in the evenings, sometimes during the day, just to talk about how we wanted to partner through the pandemic moving forward. And that was really important, especially as the pandemic went on, because it was really important to message that we're all on the same page with what we need to do with face coverings or certain types of public health controls. It was really helpful to have colleagues from throughout the region, all the way up to Boulder, come down to Denver for those press conferences, so that it wasn't just Denver, it was the entire region. We're all on the same page. And so I just really appreciate my colleagues throughout the region and just the value of MDPH and all the work that everybody here is doing. It certainly takes a village in public health these days. So thank you all.
Thank you all. And I see Michael's here from Douglas County Health Department. He is our newest chair on MDPH. And so we are all very grateful to have you here. Mike, is there anything you wanted to add?
Nothing really to add. I'm excited to see 82 participants. So I hope there's some people that'll find out something new and find a way that they can dig in and help out with everything that's going on. So thank you.
I wholeheartedly agree. Thank you so much. And thanks to our 5 chairs for your welcome and just for already highlighting some case studies about why MDPH has been successful, what we've been able to accomplish over the past many years, and we'll get through that in a second. But thank you for your leadership and your commitment to MDPH, to all 5 of you. We would not be where we are without the 5 of you and your strategic guidance and leadership. So I appreciate your commitment to this collaborative. All right, let's get into it. Let's get into the meat of all of this. We're going to start by describing the history, the structure, and the goals of MDPH. And if you're just joining and you have any questions, as I mentioned, feel free to put them in the chat, but we'll answer them at the end. And so hold your questions to the question and answer session, and we'll be able to get to all of it at once. All right, the Metro Denver Partnership for Health, or MDPH, as you're going to hear us describing from now on, is a partnership of key health stakeholders and decision makers committed to improving health in Metro Denver through regional action. MDPH serves the 7-county Denver metro area, so that includes Adams, Arapahoe, Boulder, Broomfield, Denver, Douglas, and Jefferson counties. In fact, MDPH's work impacts over 3 million Coloradans, which is over 60% of the state's population who live in this region. So why do we work together? Health does not recognize county borders. We cannot achieve our mission of improving population-level health regionally without strong multi-sector partnerships. This is a collective impact model that we're utilizing. Our vision is improved health in Metro Denver through regional collaboration, and we do that by building partnerships across our agencies and sectors to increase capacity for achieving that vision. So who is a part of MDPH and how did we get here? So we are almost 10 years old. MDPH started in 2014 and consists of the local public health agency partners in the Denver metro region, or LPHAs. It also includes the healthcare systems and the area's regional accountable entities, those who coordinate Medicaid services in the region. The Colorado Health Institute, so myself and some of my colleagues who are going to be talking today, are helping be the administrative, the coordinative, and the fiscal hub for MDPH. Because we know it takes strong cross-sector partnerships to influence health, MDPH also works alongside regional leaders in the human services departments, health alliances, the Behavioral Health Administration, community-based organizations, government, and others for it to achieve its goal of promoting health and well-being across the region. In addition, MDPH collaborates closely with community to help inform and guide our work, for example, by sitting on advisory boards or working with us with our ambassador programming. It's important to ensure that the people who will be most impacted by the activities we implement are included in those decisions and how to get there. These relationships that you see on this slide take time, but are the foundation to trust and long-term commitment towards that collective action. Here is a list of all official MDPH partners. There's 17 of us. So they've been in alphabetical order here. If you have worked or been a part of MDPH's efforts or sitting on a work group, for example, in any capacity over the past 10 years, please pick a reaction emoji. I'd love to just say hi and see you and see who's here. You can do the celebration, the happy, the heart, whatever works for you. It's just really great to see you all here. Thank you for being a valued member of our community and our coalition and for your commitment to the health of all Denver residents. There are many more partners that we work with in different capacities, but I just wanted to note here are the official MDPH partners. All right, so in 2020, we created a governance structure that includes a process to help our cross-sector partners more effectively and equitably come to consensus on our annual focus areas. We have to be strategic with what we work on annually and with what we work on regionally. Although there are many focus areas we could work on, we can't do it all. So we consider 3 principles when deciding what priority areas to work on each year. The first principle we use to make decisions is that healthcare, public health, human services, our RA partners, et cetera, can have greater reach and impact by working collaboratively across the region and by contributing unique skills and strengths. Secondly, we want to ensure that our activities are aligned and that they enhance, not replace, any of your local work already occurring. Regional approaches will be designed to minimize burden on community partners and really help you in your day-to-day work. And lastly, we make sure to focus our work on shared health priorities. That is chosen regionally through community health assessments or your public health improvement plans to really assess what our common priority areas are. We know we will have greater impact by leveraging those existing priorities of individual level partners for our regional good. These three principles, reach, enhancing current efforts, and shared priorities, help guide where we focus our time and energy each year, which is codified in our annual scope of work document. You may have seen this before. This comes out usually around December of every year. MDPH has many intended outcomes we aim for throughout our work. The first is improved partnership and collaboration among sectors, which we hope is a result of increased trust and respect amongst all partners at the table. We also aim to increase alignment in our public health assessment and implementation plans, as I just noted, resulting in increased efficiency and consistency in engaging with our stakeholders. Our collaborative approach hopefully reduces burden on our communities. Other outcomes might include improved and accessible data at a regional level, clarity in our voice, and improved funding reach. All of these are intended to address our goal of improved health and decreased disparities in our region. All right, I think this will be very helpful for all of you. This is our structure. We have two levels. The first is the committee level at the top here, and the work group level that you see on the second row. The MDPH Regional Collaborative Committee, which is the blue boxes, what you see on the left-hand side, provides a platform for shared leadership, capacity building, and networking opportunities across all of the sectors of MDPH. The MDPH Local Public Health Agency Steering Committee, which is those green boxes on the right, include executive directors from each local public health agency who work together on shared health priorities. These two committees guide MDPH's strategic direction, identify those gaps, emerging opportunities, what new and current topic-specific work groups we want to implement, and ensure MDPH is proactively improving health and addressing inequities in Denver. And as we mentioned, CHI provides the facilitation, the strategic services, and the administrative support of MDPH. So what you see on this board is if we refer to MDPH, we are referring to the entire collaborative, which is that umbrella term here. And there might be different work groups you might be working on. We might refer to the RCC, which is the Regional Collaborative Committee, and all of us really work together under this large name of MDPH. All right, on to our next section of our agenda, which is our 2023 priority areas. So knowing how we got here and what we aim to do, we want to talk about those activities and goals we're working on to achieve just that. Each year, we're committed to collaboration, networking, and focusing on the priorities that are guided by our principles. I want to note that just because we don't prioritize something one year doesn't mean that it's not important and that we can't work on it in the future. Emerging issues and health needs constantly change, and we work together to decide what areas we can all agree on that are sustainable and impactful. It's important for us to go a mile deep rather than a mile wide sometimes. And I might even say we're going a mile wide just because we have so many priority areas that we're going to go through today. So we're going to go through those now, and we're going to discuss our goals and activities with each. So I'm going to hand it first over to Suman Mathur. She is our facilitator for the Health Equity Work Group, and I'll let her introduce herself and describe more about this priority area.
Yeah, thanks, Nicole, and welcome everyone. Just want to reiterate everyone's thanks for you all being here today. As Nicole said, my name is Simon Mather. I'm a program manager at the Colorado Health Institute as well. And I have the wonderful opportunity and fortune to facilitate the health equity work group within MDPH. And really, I'm up first because this health equity group is really intended to be cross-cutting and really support the work of all of the MDPH work groups and MDPH partners. Our goal is to really assure that each group is using a health equity lens to collectively achieve that goal of decreasing disparities that Nicole mentioned earlier. So the way that we are striving to do that task is through a few different things. So first, we are currently meeting bi-monthly with some task in between. And during those meetings, we're focused on three sort of buckets of activities. The first is to cultivate an inclusive community, and we're doing this in a few different ways. One being thinking about shared resources, language guides, other shared commitments to address health equity across the Metro Denver region. The second is to build capacity for workgroup members and MDPH partners. This group is just such a wealth of knowledge and expertise, and it's been really wonderful to set aside some time at our meetings for some peer-to-peer sharing, as well as for folks to kind of like bounce ideas and things off of each other of what's going on within their organizations and across the region. And finally, we want to help MDPH be a regional leader in health and racial equity through developing and sharing best practices. So one of the ways that we're looking forward to doing that this year is by leveraging all the work that so many of our members and partners are doing around community engagement and really asking ourselves what is working well and what needs to be improved. And is there a way that we can collate that information and share it out so that across MDPH, we have a shared understanding of what good, meaningful, and equitable community engagement looks like. So I'm looking forward to working on this more with all of you. And with that, I will turn it over to the next priority.
Thank you, Simon, and thank you for helping facilitate and keep this work group on track. It is, as she mentioned, a very important work group that helps all other work groups progress forward. All right, I'm going to go over the next two work groups. I am the facilitator for both immunizations and behavioral health. So secondly, immunizations, our goal is to address inequitable outcomes of vaccine preventable diseases by promoting immunizations through community-based ambassador organizations. So what do we mean by community-based ambassador organizations? This is this ambassador program model. One of MDPH's shared priorities and approaches for its work is to partner with community as shared decision makers to improve trust, address disproportionate COVID impacts, and other vaccine preventable impacts, and prevent future health disparities. We've been working on this program since fall of 2020 in response to preventing an already strained healthcare workforce from caring for both a high level of both influenza and COVID-19 patients. We will have a final report out on our outcomes and methods actually later this spring. It should be published in June. And if in the meantime you want to learn more, you can read more about this model in the Denver Post or Kaiser Health News, and we're happy to put those links on our website. Over the past 3 years, MDPH has partnered with 41 trusted local leaders from community-based organizations in Metro Denver to promote the importance of COVID and flu vaccination. And liaisons from Metro Denver Partnership for Health partnering organizations, such as you all, have met monthly to discuss challenges and successes together. I do want to highlight some exciting new data that's just hot off the presses as we're writing this final report. Since last spring, ambassadors hosted 94 vaccine clinics through this program and able to report over 2,000 people vaccinated through these events, and at least 600 of whom were from priority populations that we have prioritized. This is exciting because these are hard to reach populations that we haven't been able to connect with in other more traditional ways. More data to come as this is published in June, and you will all get that final report soon. So related, MDPH has also prioritized stigma and mental health. We adapted that community ambassador program to reduce stigma associated with mental health among priority populations by partnering with CBOs to increase their capacity to promote messages within their communities. This program is currently funded through 2023 and includes right now 8 ambassador organizations currently working on a range of interventions to educate the community on mental health and mental health stigma. MDPH also works on other behavioral health issues such as substance use or emerging legislative issues during our monthly work group meetings. So we also have a monthly work group meeting in addition to our liaison meetings with Behavioral Health Ambassador Program. There is a lot to do in this area. So if you are excited and interested, we are always welcoming new members to this work group. All right, I'm going to hand it over to Kirsty Klaverkamp to discuss two other work groups she helped lead under MDPH and let her introduce herself.
Thanks, Nicole. Great to see you all. Thanks for being here today. We are privileged and honored to be a part of this work. My name is Kirsty Klaverkamp. I'm a program manager on the team at Colorado Health Institute. And like Nicole said, I spend a lot of my time supporting MDPH's Social Health Information Exchange Initiative. Social Health Information Exchange, or SHIE, is really about advancing whole person and whole family well-being by connecting healthcare, human service, and community-based providers into the stronger network so that we can more effectively and efficiently coordinate resources and services for people across the region. This initiative is not about developing or selecting a single platform or system for all providers to use. It's rather about creating this larger community of care or ecosystem where just different systems are connected via interoperable technology. It's a place where providers can use the program or data system that works best for them and their community while being connected to this broader network. And this ensures everyone is aware of the resources, services, and choices that individuals and families have to meet their health and social needs. And also, by appropriately and securing this information across sectors, MDPH partners will also be able to understand and address resource gaps, looking to improve and advance community health improvement planning moving forward. But it's important to recognize that data and technology are only part of the solution. Within this MDPH initiative, we are really focused on developing and sustaining the trusted cross-sector relationships across providers and with community. This is because we know this will be the foundation that needs to be created and sustained for this connected community of care that we envision when we talk about SHIE. And so we're working toward this vision for SHIE in a few ways. We're developing and facilitating implementation, accountability, community engagement, and sustainability activities. And this also includes convening a community board to ensure that community-driven priorities and decisions are at the heart of this work. This is one of MDPH cross-sector initiatives, and there are a variety of ways to get involved. So please reach out if you want more information about some exciting work that's coming up next. We're moving from planning to some implementation work for this initiative, and we couldn't be more excited. All right. With that, I am going to share a little bit about our climate and health work group. This is a work group that's seated by our local public health agencies. This work group is currently undergoing strategic planning, but what I can share with you today is that we know this group will be focused on advancing public health planning and response by supporting relevant policies and programs that address the impacts of climate change on health. And so I'm happy to be a part of this work group by facilitating it and moving forward. The work group wanted to recognize that both adaptation and mitigation are part of the solution, and that public health agencies are in a unique position to support adaptation-related efforts. Adaptation refers to actions taken at individual, local, regional, and even national levels to reduce current risks of a changing climate and to prepare for impacts from future changes. Some examples of adaptation-related efforts may include establishing statewide cooling standards for schools or training the healthcare workforce to be more equipped to recognize and care for heat-related illnesses, disseminating information to communities so they're aware of resources and safety measures to support them, perhaps in times of poor air quality or flooding. Mitigation, on the other hand, refers to actions that reduce the human contribution to the planetary greenhouse effect, such as reducing air pollution. And we think it's important to understand and name these two different approaches because, again, the work group believes that both of these will be a part of the solution. And in the coming months, the work group will be identifying activities or ways in which they would like to advance equity, improve communication tools and resources, and improve data collection and analysis, all in service to improving and supporting climate and health-related planning and response. And as Nicole outlined earlier, right, this work group is all about creating a bigger impact by coming together because, right, we know that poor air quality doesn't necessarily stay within county lines, just like so many other topics and priorities we talk about within MDPH. And so I'll be looking forward to keeping you all updated on the work group's progress as they identify their priorities and strategic initiatives moving forward.
Thank you, Kirsty, for that overview and for your leadership with both of these. For everyone's reference, SHIE is not just one work group, it is many. And so Kirsty helps lead the entire initiative. And so if you have questions about that, she is your go-to gal to ask any questions and get involved. And we'll talk a little bit about more how you can get involved in a couple of slides from now. So thank you, Kirsty. There are a few other priority areas that we focus on under MDPH, and those are actually led by the local public health agencies. CHI is not a facilitator of these work groups. We have worked on these throughout the past 10 years, and they've just changed in different capacities. So the first is the Healthy Beverage Partnership. If you've heard of this, this is actually led by Public Health Institute at Denver Health. They do sit under MDPH and come to the local public health director steering committee meetings to provide questions and answers and provide get guidance from the local public health directors under that initiative. And then we also have the local public health agency maternal and child health teams working together through the Colorado Partnership for Thriving Families. A lot of the work under early childhood and health has been transferred over to the human service partners, but is still a part of our priorities and some of the work that we oversee and overlook and provide strategic direction on. MDPH also responds to emerging issues as needed. As Bob noted, the COVID-19 response was one great example. And I know many of you were part of the COVID-19 response. We had at least 5 or 7 different work groups under that during that time that have sunsetted, all the way from mitigation to prevention to resource navigation to school support. And the only thing that has kind of stuck around as an official work group is the immunizations work group. However, a lot of that work has stayed and has been the basis for what we do moving forward under MDPH. Most recently, other emerging issues as needed that we've responded to or discussed or written letters on or had people join us for meetings were monkeypox and kratom regulations, for example. And so things come onto our tables every day. And so if you have questions about this topic, if it feels like it's aligned, if MDPH should talk about it, let me know. We can bring this to our chairs. And this is what our chairs discuss every month about what we can do to focus on new priority areas. And every month we have something new. Gun violence prevention is another example. And so those are the type of things that we talk about in those meetings. Just to give you a concrete example of what we worked on over the past couple of years, I wanted to highlight some pictures and activities so you could actually see what we mean when we talk about these work groups and what we're actually implementing under the MDPH umbrella. So first, we created a guiding document for working with priority populations that's actually now actualized across all programs. That's this public health strategies for priority populations. You've probably heard us say priority populations quite a bit during this call. You can view this on CHI's website. We also created and launched a COVID vaccine campaign back in 2021, focused on pediatric vaccines. And as we noted, we have those 2 community ambassador programs where we partner with CBOs to promote positive health behaviors. Here is the mental health ambassador report in Spanish. As Kirsty noted, MDPH has the regional social health information exchange efforts. And here's an example of one of their annual convening event flyers. And so you can get an idea for the things that we produce, the things that we run, the things that we host here. There are so many more. These are just 4 highlights of 10 years worth of work. So I just wanted to highlight these for you so you can get an example. Again, take a look at our website. You can even go to covidfreekids.org. These are the things that we help lead at MDPH. All right, our next section is Workgroup Expectations. So what does this all mean for you, actually, as people who help move MDPH along and sit as participants under MDPH? Before we get into expectations of workgroup members, of staff members, we wanted to let you know what you should expect of leadership and of CHI. MDPH leadership, which consists of the chairs and the executive directors and the regional collaborative committee attendees, which is under that blue bucket of MDPH, are committed to identifying strategic direction and responding to emerging opportunities to improve health, providing a platform for shared decision-making and networking, addressing capacity and workload needs, and reviewing funding needs and requests. These last two ones are ones that we have heard are challenges for all of you participating on MDPH. And so I want you all to know if you have concerns about actively working on work groups or what the funding needs are specifically to make sure that a work group can implement their activities. We are here as leaders of MDPH to talk through these requests and to be your partners. So if you have questions on who MDPH leadership is, let me know. Let your executive directors know. If you're connected with your regional collaborative committee partner, talk to them, and we're able to bring this up to the committee level. And this is what we're here to support you on as we move forward. In addition, CHI, as the hub of the Metro Denver Partnership for Health, is committed to continuous quality improvement in all we do. We are here to gather feedback from you all to improve our processes. That is our goal. We want to make sure that you all are satisfied with the work that's occurring and that it's making real change. So that means also ensuring collaboration and coordination among our work groups and partners. Me, Summon, and Kirsty are here to make sure that work groups talk to one another, that they're aligned, that they're coordinated, that we're not duplicating efforts and activities. That's our job here. We want to make sure that you all are satisfied with that as well. And also integrating community voice, equity, et cetera, and best practices in all that we do. That is our commitment to all of you and what we aim to ensure through our work plans, our logic models, our outcomes, et cetera. Now we will go over expectations of work group members. Each work group has a charter and a work plan, and specifics may actually differ. However, overall, we expect work group members to actively participate in work group meetings. That includes helping us identify goals and outcomes and logic models. This is for you all, right? We want to make sure that the goals are relevant to you and to your work. We also expect members to champion and actually implement the activities and the goals that are identified. We at CHI are to help facilitate that process for you all to implement those at your organization or across the region. Related, to complete action items in a timely manner. I hope that what we are able to present to all of you after meetings are clear and that you know what next steps are, but we hope that you are able to actually follow through with some of those action items. Identify funding opportunities. If you see funding opportunities that may support this work and help us move it forward, that is amazing and something that we can work on together to identify if MDPH applies, if a local public health agency applies, if an individual level partner applies on behalf of the region. Those are the type of things that you all are on the ground and hear about day to day. We also expect you to reach out to the facilitator or to your chairs regularly with feedback to make sure that we are doing a good job. And if you're leaving your organization or transitioning off for any other reason, notify leadership or the facilitator who might be replacing you, what the plan is to make sure that your organization is represented in MDPH and in its work groups. You are a part of making this collaboration successful. We hope that by participating, that you are giving and receiving for a collective good. We also urge collaboration outside of this formal MDPH structure. Please reach out to your colleagues across other organizations and agencies for other future project ideas, even if it's outside of MDPH. This collaboration is for you. This is for you, and we want to make sure that it accomplishes what you need to be able to do your job effectively. So if you're not a part of MDPH, how can you get involved? The first is to work with MDPH leadership to identify work groups that might be of interest. That could be based on your subject matter area. That could be based on your professional development interests. And again, let me know if you have questions on who that leadership is. And then reach out to the work group facilitator or to me for information on joining meetings or for our listserv as a whole. If you have questions on who is who and who to reach out to, I can be your main point of contact. And my information is on the last slide that we'll share on the screen in a little bit. So you're always welcome to email me. even if you have questions of how to get involved or listen into committees or decisions, I'll be there to help guide you through those questions as we move forward. So those are all of our orientation topics today. Here is time for our question and answer session. And let me see what time it is. We have about 5 to 10 minutes or so for questions, so plenty of time. And feel free to add them to the chat, raise your hand, go off mute, and we can hear from you. But I hope this webinar was informative and helpful as you get to know the pieces of who MDPH is. You probably heard this through the grapevine or you've been a part of it, and now you can kind of see how everything works together. And I hope it was useful for you all. So we're going to open up to questions. I did receive one question in the chat that we will start with. The first is related to how we can work with clinics to give vaccines to Health First Colorado members. These are the questions that have kind of come up through our liaison process with our immunization work group. If you have questions about how to work with others to be able to provide vaccines, I can connect you with those who are actually doing that type of work, who can help set up clinics and who are really working to coordinate those efforts. Dr. Schley is one of those individuals. And so if you have questions, feel free to email me on that. The specifics of what we do with the Community Ambassador Program are not hosting clinics ourselves. The community ambassadors partner with the state agencies or local public health agencies to host clinics. And so we can be able to bridge those connections for all of you. So that was one question I received in the chat. And if I'm looking, I don't see any other ones. So we'll pause here and let anyone chime in, raise your hand. Actually, if you do want to raise your hand, if you know how to do that on Zoom, that might be easiest so I can see who's first and we can go down the line. If you don't know how to do that, that's okay. And we can have others chime in. Judy, yeah.
You know, I just wanted to highlight that one of the beauties of Metro Denver Partnership for Health is the ability to work with people across organizations and meet new people and hear new ideas. And so I would suggest that if you have an interest, we're all adult learners, we always want to grow and develop, that you consider it. There's some really interesting stuff going on in the various work groups, and it's pretty exciting. So just want to do a shout out for that participation. It's a lot of fun.
Thank you, Dr. Schley. I wholeheartedly agree. And the more participation we have, the more effective we are as we make sure all of your voices are included. So thank you, Summon, for adding the link into the chat for Alex. Alex, if this doesn't work, the other thing I wanted to mention for everyone is that MDPH has a website, and if you click a link that says go to the COVID site, which is a different site because there was too many documents, the COVID website under the MDPH website has all of these materials such as actualizing equity in vaccine distributions, priority populations, containment work group stuff. All of that's on the COVID site. Actually, CHI is migrating websites as we speak. And so this website will look totally different probably in the next month or so. And we'll make sure you all get the new links, that you have the archive links so you don't lose anything. This website will be easier to navigate, easier to find materials. We'll have pages for the projects. And so this is good timing with our webinar. We wanted to host this so we can put this on our new website under CHI. So stay tuned for more. This is a very timely question to find these links. Thanks, Alex. And thanks, Simon, for adding these. Tiffany, great question. I can access the equity initiatives and focus areas there. So the website right now is a little out of date. It includes some of the focus areas overviews, but it doesn't include all of them. It includes documents and reports that have been recently published, but what we're going to be doing is making sure what you saw on the slides today are aligned with what you see on the website in the next month. And so Kirsty, Summon, and I will be working with our communications team. For now, you can access some health equity documents in there. If you'd like to see more, we have a Google Drive with best practices and everything that we'll be sharing. But everything that's on the CHI website is the publicly available, most up-to-date information. I hope that helps, Tiffany. Other questions or anyone who wants to raise their hand? All right. Well, I'm glad we were able to answer everyone's questions. I hope that that's what that means. If you also want to know more about MDPH, you can also watch last year's webinar. You can kind of compare and contrast, but a lot of that's out of date. Our partners have changed over the course of the past year. And so this is more relevant, but again, everything will be on the website. So thank you, everyone. I will make sure to stick around after the webinar. So if you have questions for 5 more minutes or so and just want to ask me separately, we can stop the recording. But I want to say thank you all for joining us. Here is my contact information, so you can email me here at CHI, and we are happy to answer any questions, get you connected to any work groups that you might be interested in. We are grateful for your leadership and for your commitment to the region and to collective action. And thank you for being here today. We look forward to 2023 and great work. And thanks for improving health in Metro Denver. Thanks, everyone.
Thanks, Nicole. Thank you.